Low back pain is one of the most common reasons people stop exercising, not because movement is bad, but because they're moving their body in a wrong direction. In this video, I want to help you realize why certain movements make your back feel better and others make your back feel worse, and how recognizing the likely mechanism of your pain can guide you towards safer and more helpful exercises. Hi, I'm Dr. Jeff LaBianco, Doctor of Physical Therapy. And the biggest mistake that I see with low back pain is treating the back the same, instead of matching the movement with what the back has been dealing with day to day. The spine adapts to stress. If it's repeatedly moved in one direction, it usually responds better moving it in the opposite direction, not more of the same. That's why a stretch that can help one person's back can actually irritate the other person's back. Let's start with the most common pattern that I see. If you're performing movements throughout the day, such as sitting at the computer for long periods of time, or scrolling on your cell phone, or driving in a car, commuting to work, and then coming home and sitting on a couch, you're putting a lot of flexion movement into your back. Over time, this flexion movement stretches the tissues along the back of the spine. For many people, by adding more of a flexion stretch to stretch out the back can actually make it worse. So bending forward, touching your toes, or bringing your knees to your chest can actually worsen your low back if you're already in a flexed position throughout the day. In these cases, the extension bias, such as back bends or press-ups, are the way to go because that stretches the back in the opposite direction of what you've been doing throughout the day. This unloads the stress tissues and brings balance to the low back. Now let's look at the opposite situation. If you performed work throughout the day, such as raising your arms, painting ceilings, or performing overhead work, or leaning back a lot throughout the day, or even standing for long periods of time, your spine has been stressed in extension. In this case, forcing your back into more extension with exercises such as press-ups or back bends can actually worsen your back pain. It's now better to perform gentle stretches in that flexion motion, such as touching your toes or bringing your knees towards your chest. And there's a third common mistake. If your pain starts suddenly, such as lifting something from the ground or twisting or pulling your back, you actually have an acute muscle strain. In this phase, aggressive stretching isn't helpful, and performing any stretch throughout a larger range of motion can actually cause irritation and discomfort. What your body would respond to the best would be gentle movements, isometric strengthening or stretching, which is basically tightening of the muscles without moving through a range of motion. Also, core activation through a small pain-free range of motion is the best way to stretch and strengthen low back that has been acutely injured. When movement matches your body needs, pain becomes more predictable, and that becomes a lot less scary. Now, you don't need to do anything right now if this explanation has helped you understand your low back pain better. That clarity is already a step forward. And if you do want guidance on how to move forward, I put together a low back pain exercise routine which demonstrates specific exercises to help you reduce your low back pain. Understanding which direction your body prefers can make movement feel a lot more confident.